Just tell me how you're doing after a year.
Well, after a year, the experience has been very good. Been sleeping very well with the appliance, as well as having good energy in the mornings. Definitely not a morning person, but at least I don't feel like I've been awake all night, not sleeping and tossing and turning. So it's really helpful from that perspective. And no complaints from my wife from snoring or grinding my teeth either, so it's going to help in both of those areas as well.
So you would tell anybody who's kind of hesitant to do this they have nothing to lose to just go for it?
Yeah, I've recommended it to several people I know. The mouth device is something that I would definitely recommend, especially for people that try out the C-PAP machine and find it very problematic, because for me, I move a lot when I sleep and there's be no way for me to wear something like that, and this device was like a great alternative.
Did you rent the C-PAP machine and get to give it back and all that stuff?
No, actually doing the test at the hospital, my second sleep study, I had to wear the C-PAP machine, and I think the technician told me I only slept like an hour and a half of straight sleep. Aside from the sleep apnea issues, you can't sleep on your side, which I like to do a lot, and it just, the CPAP machine also, I was a mouth breather, so it covered my whole face pretty much from my nose down to my chin, and you always had to keep a seal there, so if you wanted a beard or a goatee, that was pretty much impossible with a CPAP. Cool. Because it wouldn't create the seal around your mouth that you have to have.
Oh, cool. Well, thanks for the quick update.
All right, you're welcome.
We'll see you in another year.
Okay, see you in a year.